Recovery, Ms. Jessica Parton.
You're next, Jessica. Let me say something. Go ahead and sit down. Let me say something before you have questions for Jessica. As you know, we had money coming in from several different angles for the opioid abatement. One pot of money is extremely restricted to programs, education, etc., to help with the opioid crisis. We've looked at money for various organizations that might fit the less restricted money, but we've not found one except for Revita that would fit that first pot of money. Right now, Eric just gave me the figure, it's $289,000. So they're looking to, tell them what you're looking to do again.
So I brought Mr. Lee Dilworth with me today. He is our CEO, and he's got all of the numbers for you all. But Revita Recovery is we are a medication-assisted treatment facility. We work with people that are struggling with addiction. There is a lot of internal pieces of our company. They receive care coordination with nurses when they come in. Nurses are liaisons for services that they may need, so they're going to help them with primary care doctors, any other specialty physicians that they may need to see. They also navigate social services if that patient is on probation. If they're trying to get their license back, their GED, we help them get jobs. We work closely with at-work personnel out of our Duffield office. And then they also do counseling. We do individual and group counseling. And then they see a prescriber on site. We do not dispense any medications at any of our facilities. We send in electronic prescriptions for those medications to pharmacies, and the patient goes to a pharmacy and picks that medication up. We do oral medication, but we also do long-acting injectables. So the patient comes in every 7, they can come every 14 days or every 28 days, and they receive an injection. There's no way to get the injection out. Once the medication goes into the body, it's there, and it stays in there. And so that is a little bit about the program. We also do hepatitis C treatment. Northeast Tennessee is a hotspot for hepatitis C. And then we do PrEP treatment, which is also, treatment for the HIV virus. We partner with the Virginia Department of Health for harm reduction, where we go through the steps of what harm reduction looks like. We do Narcan training, we do education, we work with school systems, all of the things. I've met with Mr. Hickson here in Hawkins County about partnering with the school system this year. I have 2 daughters in middle school, so it's important for me that my children understand what addiction looks like, and that their classmates also have an understanding of that. So I'll let Lee kind of talk about the numbers that we have, and then.
Can I ask you a question for you?
Absolutely.
Does that medication involve Suboxone or Suboxone?
It is buprenorphine naloxone, which the brand name for that is Suboxone. We also use Sublocade and Brixadi.
Do you all write prescriptions of Klonopin along with Suboxone?
No.
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 It's very prevalent, Klonopin, gabapentin, and others. We don't. Sometimes patients come to us with those medications and we have to taper them, whatever's appropriate for that patient, but no, we don't initiate those.
Is there
No.
an end date or an expiration on how long a patient can come and receive a Suboxone prescription, or is it just as long as they show up, they get one?
So the way that I explain a treatment for Suboxone is addiction is just like any other disease. If I'm a diabetic, if I take my medication and I watch my diet and I exercise, eventually I may be able to come off my metformin. But there's some people that are never able to come off metformin, and they'll need that forever. And we do have patients that have been coming to us that are what we call our maintenance phase, our stable patients. They've come to us for years, and it's the accountability piece of it. Because addiction is just like any other disease. You have to be able to maintain and have that accountability. there are things that patients have to meet criteria in our program. So you have to complete counseling. You have to work with your counselors either individually or in group. All of our patients receive drug screens when they come in. We have our own lab that we process drug screens through, and the prescribers review and discuss that with patients at each visit.
Will you remind me what schedule Suboxone or Subutex is on in terms of how it's enforced through law enforcement?
Controlled substances, 2 or 3.
Schedule 2 or 3.
What about the patients that become addicted to Suboxone?
That's not possible. I mean, it has naloxone.
It is,
So-
I see it every day.
Okay, so let's, Jesse, you want to talk about that? Or you want to?
So the difference with the Suboxone and the patients that are out using opiates, when you're out and you're taking Oxycontins or Lortabs and that kind of thing, when you take Suboxone, the difference between taking Oxycontin and taking Suboxone is very different. It's not, you don't have that effect of the high that you get from opiates.
Yeah, because Suboxone blocks the opioid receptors.
Right, and it keeps the patients from overdosing because you have the naloxone as part of that. And so when we have patients that are stable on Suboxone, then those patients are out and they're re-engaged back in their community. They're having jobs. They're able to get their kids back, finish out their probation, that kind of stuff. We've seen a lot of success with our patients. We work very closely with the Scott County Sheriff's Department and their return to work program that they have through the state of Virginia. And you see a difference in the patients. They're not in and out of the jail, the judicial system, that kind of thing, as much as they are when they're out here and they're looking for their next high.
Can I respond to that? Say, you asked about Subutex. Subutex is the pure synthetic opioid. Someone, if they're taking that, then that can be diverted and that will produce a high.
Yeah.
Absolutely right. That's why we rarely ever prescribe that. That's only for patients who are pregnant patients and who have a proven allergy to it. And they have to show us that. Otherwise, we're only prescribing the buprenorphine, which is a combo product, which has that pure synthetic along with the product that's in Narcan. That's a combo. And so that Narcan keeps it from getting a high that one can get high from. But if they're taking the pure Subutex, that is possible.
No.
That's what we're asking for
That's what
money
they're
for.
trying to do.
So this money would be to fund the construction of an office.
Yes.
The request for funding is open here in Hawkins County, and to use some of the money that comes to Hawkins County from the Opioid Abatement Council. The Opioid Abatement Council of Tennessee is going to receive over 18 years like $1 billion, and over 4 years, Hawkins County is slated to receive $1 million, and to be deployed for treatment, abatement, remediation. We have 12 centers. We have 9 centers in Tennessee. We have 4,000 patients. We're accredited by something called the Commission on Accreditation of Rehabilitation Facilities, and we're the only provider in East Tennessee and Southwest Virginia that is accredited. So I was a former healthcare lawyer. We run a high-quality program, and I started it to help people. I'm not a recovery. So we need help. We've asked for, when I brought the proposal that we passed out in June, if anyone wants another copy, but it's great to be back in Hawkins County, by the way. But we've asked for funding for 2 things. One for startup costs for the first year or 2 and a little bit less each year to pay for the office, the cost, the staff, the doctors, all that. And then we've asked for $150,000 over 3 years to pay for treatment for residents of Hawkins County who can't afford it.
So, I'll say this, and I know your mission sounds fantastic, and it sounds like you guys have lots of treatment options in place because of the opioid epidemic that we're facing. You know, understanding we're from Appalachia, you know, every single one of us has been touched by the opioid epidemic in some way or another. When I hear Suboxone, I will get a little anxious though. I do, because I do believe that medication gets abused. I've seen it get abused, and it just makes me a little nervous. I'd like to. We don't have a resolution in place for you right now today.
Okay.
At least it will give me a chance to dig a little more deeply and hopefully change some of possibly my ignorance, and hopefully I can learn more about what it can do, you know, on the positive side, because my experience is just not good.
It's not positive.
Yeah. So I would like to learn more, I guess is what I'm saying.
That would be great.
And I would invite any of
Those
you.
discussions.
Right, and I would invite any of you. We have an office in Johnson City, we have an office in Morristown, we have one in Newport, and we have one in Greenville. So we literally are all the way around Hawkins County. The reason it's very important to me is I've lived in Hawkins County my whole life. And my children lost their dad to an overdose. And so it's very important for me. He didn't travel much out of Stanley Valley. And if treatment options would have been a little bit more closer to home for him, then maybe the outcome would have been a little different. And so I would encourage any of you all, I can give you my cell phone number if you want to come out to any of our offices and meet with our prescribers, meet with our counselors, our state medical directors. I would even meet with some of our patients. I would very much encourage for you guys to take a field trip. It'd be a great day.
And I would like to point out that Jesse, you're from Rogersville, but Jesse is our regional operations director, so all of those centers report to Jesse. She's responsible for their operations. And there's a chief operator officer that she reports to, but she's here locally and she runs them.
So if I could ask a couple of questions. One, you all are a for-profit or non-profit organization?
Technically formed as a for-profit. We've never made $1 of profit. But yeah, we're technically a for-profit company that's never made any money.
Okay. So I guess that maybe you just answered my next question, which was, I would imagine if you want to place a center here, you would see the opportunity for profit here long-term, because we wouldn't be able to subsidize that long-term, right? You're just asking us to offset the
Startup costs.
the startup costs. And I guess my question is, if there is an opportunity here for a for-profit business in your area, why would we need to front those costs? Is there opportunity if we don't do this? If we don't subsidize it, would you move here anyway?
No, we haven't because of the startup costs. We haven't. We've been in business. You know, we've operated these centers. I started in 2018.
Yeah.
And so we've not. We have had a noticeable number of patients from Hawkins County in the last year and a half. You can speak to it more directly, Jesse, in terms of precisely than I am. I know that we have a lot of patients from Hawkins County in the last 18 months that have come to our other centers, and we've noticed, wow, there's a lot in Hawkins County. Maybe we should go there.
We currently provide services to 145 residents that live in Hawkins County. And they are driving as far as to our Duffield, Virginia office to receive treatment.
So I think my reservations are a couple of things. One would be the long-term sustainability. If startup costs, because I know it's a considerable amount of money, I don't know what the request that you're asking for, but if it's, you know, in the neighborhood of the $289,000, that is a considerable amount of money. But if you were to operate here for the next 10, 20 years, that's really not that big of a startup cost for a business, not really. And so in the event, you know, we subsidize the startup costs, we do a big to-do down here, and then long-term it may not make sense for you, right? Because you can't, it's not sustainable. Do you foresee that being a problem long-term, or is it this $289,000 really going to offset that much cost over the next several years?
Well,
To make that sustainable?
it subsidizes the startup costs in the first year or 2 years. We've gone it in other places new, and we've not closed any of those, I'll say that.
Okay.
We've not closed any of them.
And I think, Josh, you've lived in Hawkins County as long as I have, and we kind of live in the same area, and it is a generational, and that's what we're seeing. We're seeing generational. It's, you know, it's great-grandparents and grandparents, and now my daughter is in the 8th grade at Circleville Middle School, and it's a conversation that she and I have often about boys vaping in the bathroom, and they're vaping dab pens. And dab pens their parents are buying them across the state lines in Virginia, and they're bringing them back home, and the kids are passing them around in school. And so now here we are in this generation. And so to say that Hawkins County is never going to need the kind of services that we are offering, I don't know how that is ever going to happen, because we see it. I've seen it my entire life. I think if you have a family that has never been, that had somebody in it that has struggled with addiction, you're very, very blessed, because that's just not the reality, especially not in Hawkins County.
And my last reservation, I'm sorry, go ahead.
No, I was going to respond to that point a little more and say that the goal is that patients come to us, some of them have no resources, it's part of the problem, that they don't, and they need sociological supports from social services, but they have no resources. And so they come to us and we're able to help them get treatment for free, and then eventually the goal is for them to get employment, to get off of this type of supplementing, and to get on insurance from their employer, and to get jobs, keep jobs, get a car, keep a car, same with the house. And so they kind of move off the program. That is the goal. That is our definition of recovery.
Sure. Yeah.
What percentage of people start your program and move on?
I know it's tough to, depends on what you mean by recovery, but well over half of our patients do.
My last reservation would be just the echoing some of the concerns about diversion, right?
Yes.
And I've talked to, so me and Jessica, you and I talked some time ago about this, and you know, I have a lot of friends, a lot of people that I know I went to school with, a lot of acquaintances that are recovered addicts, and I'll be honest with you, I'm not talking to one who thinks this is a good idea, and that Suboxone was medications were not a part of their recovery. They don't feel that it's they say that in the streets that it is diverted so much that the risk is not worth the reward. Now, I'm sure you have patients who could counter that argument, right? Who could say the exact opposite, and I may change my mind as we go through this. But I just wanted to be upfront with you and tell you I've not talked to one person in my, which is anecdotal, but in my circle of the people that I know, I've not talked to one that said they recovered because of medication, nor would they recommend that we subsidize this. So
I understand that I've encountered this experience in the last 7 years of doing this. Many people who are abstinence only or who use Alcoholics Anonymous or an abstinence path, they believe that that's worked for them and that's the only right way, or it's at least the best way. Many people who are on the other side who have used some medication because they are physically dependent. All 4,000 of our patients are physically dependent. If they don't receive some form of an opioid, they're going to get dope sick. They're going to go be physically dependent, which is the reason they do things that we wouldn't necessarily do or make choices that we wouldn't choose. But they seem very reasonable to them at the time. And most of them are not trying to get high. They're trying to avoid getting dope sick. And medication has worked for many of them, and we work with them and we ask them regularly if they're ready to taper down, if they want to taper down, because it's a joint decision. We're required to do that by licensure. We're licensed by the state. The state comes in, TennCare comes in, all the insurance companies come in. It seems like every month one of them's coming in.
So you do bill insurance?
And doing an audit.
We are, I would say, out of our 4,000 patients, we are probably 98% insurance. We are, we participate in the Virginia Arts Program in the state of Virginia, and in Tennessee, we are through the B-Smart program.
Which is a program in Tennessee of TennCare.
So
over 70% of our patients are on TennCare. And so that comes a lot of scrutiny, a lot of requirements. They come and look at our diversion control, not just our plan, but our practices. And what are we doing to make sure that our patients are diverted?
Jesse, you may have included it in that packet that we got earlier, but do you have an audited financial statement?
We do have audited financials, absolutely,
Okay.
every year.
I think
Yes.
it would be a good idea for this
Yes, we have
committee to
audited.
get.
On independent auditors every year.
And there's not, the only insurance that Revita currently is not credentialed with is TRICARE, but we have and TRICARE is the insurance through the VA, but we have they call it a single case agreement. So if we have a patient that comes in that has TRICARE insurance, then the VA has agreed to do a single case agreement with us to where they'll pay for that patient, and if somebody else comes in, of course, we have to resubmit for that. But that is currently the only insurance that we're not credentialed with. So all commercial insurance is Medicaid, Medicare. We have a very small population of what you would consider to be a self-pay patient. And where we see the self-pay patients, those are our coal miners. that work up in Southwest Virginia that don't have commercial insurance, and so they're coming out of the coal mines
And
to,
that's about 7% of our
Yeah.
patients.
Very
So
small
everybody else is covered
population.
by insurance.
Do you all receive any funding from Virginia or Tennessee, from the state?
Well, from Virginia, only from the Virginia Medicaid program, yes. So it's, when patients come to us, we receive that same in Tennessee, Medicaid or TennCare. Recently, we were awarded a grant from the Tennessee Opioid Abatement Council. So yes, the answer is definitely yes in Tennessee. We received 2 grants, one to hire certified peer recovery support specialists, which is a designation, and to fund positions, you know, for people who have that lived experience. We also received a large grant over 3 years to pay for treatment for uninsured Tennesseans, treatment for uninsureds.
Where are you all based out of?
Nashville. There's 11 of us in Nashville. Otherwise, most of our folks are in Johnson City, and everyone's over here.
So you have offices west of East Tennessee,
Only in East Tennessee and Southwest Virginia.
but you're based out of Nashville though?
Yes. Me, CFO, operations, payroll, pay the bills, HR
So
person.
the company's headquartered in Nashville, but you
Yes.
don't have any recovery centers out that way?
No, we don't.
not in Nashville.
No. Our farthest are over in Tullahoma, which, you know, closer to Middle Tennessee. Tullahoma, Sparta. That's the farthest west. They're in Knoxville, right across from Fort Sanders Medical Center. Morristown, Greenville, Newport, Johnson City. They'd like to be in Hawkins County.
Yeah, Abingdon, Chattanooga, Duffield, Greenville, Johnson City, Knoxville, Morristown, Newport, and Whitfield.
Mhm.
Okay, any other questions for Revita Recovery? I really appreciate y'all
I'm
being
going to be
here.
fair about it when I ask the question. Percentage of accomplishments,
For our patients,
yes.
so
I mean, that may be.
every time a
Yeah.
patient walks through the door, that's an accomplishment. Because every time that they step foot in our office, then they are there to get treatment and they're not out buying drugs on the street that is
Maybe
gonna
I
kill them.
misstated. So I've been there and got treatment, when do I go off?
That's it.
What's the,
So your path of recovery is gonna look very
I guess
different.
that's what I'm asking.
Yeah.
What, do you have the percentage recoveries that's done and gone and whatever?
Depends on how you define recovery, sir. I mean, if you mean.
Okay,
No.
today I no longer need you.
Right.
Okay, so we have, I would say, I don't know.
Well, maybe that's unfair, I just,
Because we have a lot of patients that don't come to us for prescriptions anymore. They come and they check in with the counselor, so they still do their counseling. And they still go and see their doctor just to say, hey, everything's good, I've still got my job, I've still got my
that to me would
license.
be what I'm looking for,
Yeah,
the accomplishments there.
I guess everybody be different, depending on.
and it's different for
Sure,
everybody.
sure.
And the other thing I want you guys to think about is, I think we all have a visual of what a drug addict looks like, and that's just not the population that we're providing services for. I have a 78-year-old patient in the Duffield office that is a farmer. He has no idea he comes to a Suboxone clinic. He thinks that we're just his new doctor because his primary care doctor has given him gabapentin for 6 years for neuropathy in his legs. And then one day he just stopped giving it to him. He ended up in the ER going through withdrawals and the emergency room sending to us. He comes in every week with his little wife in his bibbed overalls, brings us tomatoes out of his garden, all of the things, and he gets a Suboxone prescription. He doesn't realize that he is addicted to gabapentin. He just knows that we're now his new doctor. And so it's not your typical vision that you have of what a drug addict is. That's not all of our patient population. We're providing services for school teachers, for people that are paramedics, that are nurses,
Craftsman, tradesman.
coal miners. It's not just your typical drug addict that you see. And so I want you all to,
Do you all require like a family doctor to, like a referral to you all, or can someone just walk in off the street
either. We have a lot of our referrals do come from the emergency room department if they have patients that come in that have overdosed. We have referrals that come from primary care doctors. We have referrals from probation office, from recovery courts. We've got referrals from the Department of Children's Services. So yeah, all of those are options for referral sources, or patients can just walk in.
They do have to go through a complete induction
Screening.
assessment. I mean, it's lengthy, it's behavioral, it's social services, it's housing, it's medical, it's requires a physical exam, and all that goes on. It's a couple-hour visit. So happy to answer other questions or come back.
All right,
Whatever you love.
thank you. So, well, I'll tell you, we've got a little bit to digest here.
Sure.
I would look out, if any resolutions were to be put forth, it would be for the next committee or commission meeting, which would be in September. So, we may just reach back out to you at the time, okay?
Happy to do it.
But you being here gives us something to think forward to as we progress. So, thank you all for
Well,
coming.
thank you.
And in the meantime, Mark has my email and my cell phone number. I think Josh and Danny both actually have it as well. Please give me a call if you would like to come out and visit one of our offices. We would love to have you come and meet with our prescribers and, you know, and see how we're operating and what we're doing.
Thank you.
Thank you.
I believe in you, sir.
Do it.
I said, I believe in you.
Thank you for your interest.
Thanks, Danny.
Thank you.